Hey everybody, it's Dr. Hammerstedt from Holist. I am here for a Facebook Live for you about pain control. So I'm happy to be exciting and sharing you with Dr. Mari Moon from from her New Moon Regenerative Medicine. I'm happy you're tuning in. Let's see, you might have seen my share for her a couple of weeks ago. She put something on there about food and pain control, and I've been telling all of my patients about it since then. It's super cool. So if you haven't been able to find it or seen it yet, please go back and try to find that. I'm a total, as you know, whole you food science nerd, and so seeing her post on that, was really excited about it. So she is going to be joining us here shortly. And so let's see, let me explain to her who she is a little bit while she's catching up with us here. Dr. Moon is a medical physician. She is double boarded in both physical medicine rehab and in pain management. And she's the founder of New Moon Regenerative Medicine in Ponte Verde Beach in Florida, and she's a colleague of mine in the Docs network, which is a nationwide network of mostly women who are doing telemedicine, so physicians doing telemedicine who's doing basically virtual video healthcare online. So we are going to welcome Dr. Mari Moon here in just a moment, and I believe she is signing in. So I have a lot of stoke to talk to her about today. You know, I see chronic pain every day on nearly every patient in the emergency department, and there's really only so much that I can do. And even when I can do something, I'm really reluctant to provide opiates or other non-opiate medications because I worry about side effects and I worry about so you do all sorts of non-medication based pain management. There are options with acupuncture and massage and all sorts of things, and I'm excited to talk to Dr. Moon, about her options for these non-medication based pain relief options. So Mari, I was just talking about you a little bit here while we were waiting for you to sign on.
Great.
Happy Medical Monday.
Thank you, too.
Just talking about how stoked I am to talk to you, and I was talking about how I loved that food pain relief post that you did a few weeks ago, and I was referencing everybody back there.
Yeah.
And I was talking a little bit about my struggles in the emergency department, as an emergency physician, about pain control, both chronic and acute pain control. And I'm really excited to hear from you kind of what you're doing with PRP and prolotherapy. And obviously, as a PM&R doc, you do conventional exercise and physical therapy, but I'd really like to hear first, tell us more about what PRP is and how it works and how you use it for pain control.
Yeah, I'll tell you a little bit about my background. I'm a pain physician, trained in PM&R, as you'd said, and did a chronic pain fellowship. And really, in general, same thing, struggled with, treating patients with chronic pain. We get forced in sometimes a rut of opioid medications, and patients kind of get in that cycle also. And so I wanted to break that cycle and really try to come up with a plan that actually focused on fixing some of the issues that were there instead of just treating the symptoms of it. And so that's kind of how I first got involved with prolotherapy and hearing about PRP and regenerative medicine is actually as a fellow. And we treated patients that were chronic back pain, patients that had gone through the gamut of whether it's surgery or whether it was they failed the steroid treatments. And we had significant success with treating these patients that felt like they were just at the wit's end. They didn't know what to do. They had surgery, they'd failed surgery, and now what else to do? And so basically what PRP and regenerative injection therapy or prolotherapy, they're kind of a spectrum of treatments. They're actually focusing on stabilizing the body. Now our back, our joints, our whole body is held together by tendons and ligaments, and then we have the muscles that assist that and do other functions. But when there's a breakdown of that process of stability, whether it's from an injury, whether it's from aging, whether it's from a surgery, then that also starts to break down the function of the joint, and then the muscles and all the supporting structures have to take over and do things that it necessarily wasn't meant to. And that's where people start to get spasms, people start to feel pain in those areas, and then they start to get breakdown of that area. So people can get arthritis. It's not necessarily the arthritis itself that causes pain, but potentially the surrounding structures that are not doing its role. And they also have pain generators and pain, places that they hurt too. And so with prolotherapy or PRP, we can essentially try to have your body heal itself by having specific targeted areas that we're treating, and then having the body itself signal healing factors to the area.
And so they're basically just taking your own blood and putting it back in you and using that as a stimulant to heal yourself, right?
Exactly. So PRP is actually taking your own blood. So it's platelet-rich plasma. So our blood has platelets in it. That's what signals healing in our body when we injure ourselves. So naturally, we are ever regenerating till the day we die. As babies, we do it much better than as we do when we're 80 years old. But when we cut our skin or when we hurt ourselves, we do heal, some not as good as others, and hence chronic pain issues happen. But the platelets are done. It's an in-office procedure. There's a centrifuge, and there's lots of different types out there. But basically, blood is drawn. It's separated, and so it's spun in a centrifuge, and the weight separates the platelets and the red blood cells and all the other things that are there. And then you come out with the platelets, and the platelets are in a concentrated amount, and basically you're injecting that back to certain areas. So when we're talking about pain, if we're addressing tendons or ligaments, then we're injecting into those areas or attachments of muscles, areas that may be weakened, to essentially signal the body that, hey, there may be an injury there, or we're actually promoting a controlled injury, is what sometimes we call it, to an area to actually signal your body, hey, send repair signals there. And so that's directed when we're talking to pain in those areas, and then it's used for a lot of other things.
Yeah, it's really interesting. So I know, so tell us a little bit how prolotherapy is different, and then we'll talk maybe about other applications for PRP that people may have heard.
Yeah, no problem. So prolotherapy has actually been around for many, many years, 50, 60 years, developed by an orthopedic surgeon. And prolotherapy, I always kind of think of it as the entryway to regenerative medicine. And simplistically, it's using an irritant, so it's dextrose in a diluted form. And similarly, how you would inject PRP or the platelet-rich plasma to those areas that you were treating, you would do that with the diluted dextrose. So D50 basically is what you're diluting down with lidocaine, and that in itself causes an inflammatory response. So you do get some inflammation. And same thing, tries to signal your body, hey, there's something going on here, send repair signals. And so some people will call it a way to signal your body to finish repairing what it didn't do well the first time.
Mm-hmm. Yeah, really interesting. So obviously you do all of this in person, and we know each other because we're part of a network of virtual, mostly female physicians with Rodocs doing telemedicine. So tell me about that practice, how that works for you and consulting virtually.
Sure. So in terms of that, a lot of patients have questions on really what it is. How does it help? They don't really understand the process of why it could help, and why no one else has really talked to them about it. And that's kind of the main thing, is that, once you start to explain a little bit of the process of how it is, how it works, the reasons why it works, and explain it to them in the terms that obviously they can understand and relate to, then it starts to make sense. And also the process of, why they may not have heard of it. And it's true. It's not a lot of people know about it, and they don't know about it till they start doing their own research, and then they see, hey, it actually is out there, and it's been out there for a really long time. And it's more so because of our different educational backgrounds when we go through schooling and training, is that physicians that do these trainings actually seek them out on their own, on top of whatever training that they originally came with, unless they were lucky enough to be exposed to it when they were training, and then had it that way. And it's becoming much more available for residents and fellows and things like that to start learning about now. But over the past 5 to 10 years, it was things that you had to seek out on your own. And so I use it more as an education experience for patients to understand the background of it, and why it works, and how is it different than steroid treatments, and how is it different than what they've done, because honestly, from their perspective, they think they've tried everything. And so what's that new thing that I'm doing that's going to help them?
Right.
And so when you explain it more so as trying to heal the area and strengthen the area versus put a Band-Aid and just mask the symptoms and cross our fingers and pray that the pain doesn't come back. But we know it's a chronic issue. It's going to come back once that steroid gets absorbed in the body or once they injure themselves. And so that's kind of where a virtual visit comes into play when people have questions about it. If they're not sure they want to come visit me out in North Florida, when you can give them the time to talk about it a little bit and give them information, they do a lot of homework on their own, and then they come to a conclusion of whether they want to proceed or not.
Gotcha. Great. So I do know that we hear about PRP, with Kim Kardashian and vampire facelifts, and I think it can be used in a myriad of aesthetics. But I also hear, so tell us a little bit about that. But I also hear that it's also available for stress incontinence and female sexual disorder. And just give us an overview of like what that looks like and who it's good for, and
Sure.
Educate us.
Yeah, no problem. So PRP is being applied to lots of different areas. So for a lot of people, they heard it initially for sports and sports injuries, and that's kind of where our initial discussion was about. And we saw the applications actually that it's helping in that area, and so lots more research has been done and studies have been done in the face, and so PRP can help in an anti-aging process for lots of different reasons actually. And so Kim Kardashian had the vampire facial, vampire facelift, and basically the facial means there's microneedling involved, and then there's channels that are a microtrauma that's on the skin. So those are good for fine lines and wrinkles, for those wanting to maintain good skin tone and texture, for minimal wrinkles. And then for scarring treatment, so acne scars and things like that. And so when those channels, so microneedling on its own is a treatment itself. It's collagen induction theory. It can help promote, similarly, regrowth of collagen. But when you add PRP or add those two scars, a lot of times they have a better effect, more effect in less time, can actually act as a filler when you combine it with other additives to help form it into like a matrix or kind of a thicker kind of gel, just like a dermal filler or things like that. And so you can also use it as a filler to mimic dermal fillers, but also trying to signal your body to send collagen. So people will use it to fill if they have really defined nasolabial folds, or if they have loss of volume in their cheeks. If they have other areas of scarring, you can inject under the scars and help signal repair to the scar tissue, as well as microneedling to the area. So lots of applications in that sense, where we are doing much more naturally to help preserve our bodies as an anti-aging, and fantastic results with that, fantastic maintenance results for that, and face, breasts, hair, lots of different things that we're using for men and women's sexual health.
Great. And so similarly, using the PRP kind of around the urethra is the theory for stress incontinence for women.
Yep.
I know it's a huge problem for lots and lots and lots of people.
Sure. So for stress incontinence, for those women that cough and sneeze, or run, they can't run. They feel like if they want to play with their kids and jump on the trampoline, they have that accident that they, or they didn't even know it, and they jump and they're like, oh, they have an accident. They didn't realize it. But stress incontinence, those that cough from women that have had kids, from just weakened pelvic floor muscles, to those that are perimenopausal and postmenopausal women that have weakened pelvic floor. Now, obviously, we're always taught to do our Kegel exercises and do those things, but sometimes those can only help to a certain degree, and as well as if you're not doing them properly, then that's, you're not exercising the right muscles. So essentially what this does is, around the area close to the urethra, you are injecting PRP, and it's it's not a very sensitive area, so it's not painful, even though you might think it would be, but it's not painful. Some people feel like a pressure sensation, but basically what you're doing is, similarly as putting a filler in someone's face, you're improving the tone around the urethra to help the pelvic floor have better tone to help with the stress incontinence. And so women can notice improved control less problems with coughing, sneezing, and things like that. And then in conjunction with that, you'd want to maintain your Kegel exercises and things to maintain the pelvic floor. And then on top of just stress incontinence, it can help for vaginal lubrication, for some women for sensation. If there are women that have had scarring there from births of their babies, episiotomies and things like that, you can treat that with PRP. I mean, lots of applications that, you know, we didn't necessarily think that there was an option for it, but women are having improvement with it, and safely. So
that's great. Well, that's really interesting. I mean, I'm so far here over the last 10 minutes, we've talked about chronic pain relief with PRP and prolotherapy. So check. We talked about smoother skin. That's a good check. We talked about better sex, less peeing on yourself. That all seems like good stuff. So really, I mean, it sounds really exciting.
Works for men too.
Oh, good. Works for men too. I like it.
Erectile dysfunction for men.
Good. So so here at Holist, I'm working on, building networks of practitioners, conventional, ancillary, and alternative practitioners to work together and kind of band team-based therapy. And so it sounds like PRP is something that I'm going to be super excited about looking into. And so for everybody, I just wanted to remind you, this is Dr. Moon. She's in the St. Augustine, Jacksonville area, right, in North Florida. And
North Florida, Ponte Vedra. Yep,
gotcha.
Ponte Vedra Beach.
And give her a call for an in-person virtual consultation on any of the above topics that we talked about. And you can check with Holist while we're figuring out how to dial all this in here. And again, we're both on the RoDocs, which is a virtual telemedicine network. And thanks so much for joining us.
Yeah, no problem. If you tune in, if you haven't visited my business Facebook page, it's New Moon Regenerative Medicine or New Moon PRP, as well as my website is www.newmoonprp.com. So either of those you can reach me at, and I'd be glad to answer your questions. And if you'd like to set up a consultation or virtual visit, reach out.
Sounds
always
great.
Available.
Good. Happy Medical Monday.
Yep. Happy Medical Monday.
See ya.
All right.